I've been involved in the medical education for over 30 years. And even with the first year medical student all the way through to medical practitioners, we often just don't think of acid reflux as a cause of these chronic problems. Mainly because we teach the medical students to focus on life-threatening problems, often at the expense of overlooking these common problems that just make your life miserable. Therefore, if we don't teach the medical students, they grow up to be doctors, and they often overlook acid reflux as a cause of the cough, chest pain, asthma, etc.